welcome. You're watching Medically Speaking, and with me, top infectious disease expert, someone who is a known name. If you want any trustworthy, reliable advice on COVID, I'm sure you've already checked out his account. I'm talking about Dr. Fahim Yunus. Thank you, sir, first of all, for joining us on NewsX. My very first question to you, sir. You have been time and again tweeting about the need for booster shots. Help us understand, because in India, there is a huge debate as far as boosters are concerned. There are many who are till date experts who are against booster shots. They say boosters should be given to those above 60, to those immunocompromised, but it's not for the general population. Where do you stand on the same, sir?
Thank you so much for having me. I think one thing all experts need to understand, it's not what they think, what I think, where they stand, what my opinion is. It's what the data says, what the current evidence says. And the current evidence says that if you have received 2 shots, your risk of COVID death is 9 times lower. If you have received 3 shots, meaning a booster shot, your risk of COVID death is 48 times lower. So clearly, a booster shot will reduce the risk. The question is, if you don't have adequate supply, yes, you can prioritize it. I get that. But considering equal supply, there is simply no debate in the literature about it. A booster shot would help the immunity and reduce deaths.
Right. And so, since you're also the chief of infectious diseases at the Maryland University, help us also understand the science on mixing and matching of the vaccines, because in India, there is a large population. There are only 2 vaccines available as of now, Covishield and Covaxin. There is a large population which has not received, Covishield. Youngsters, those below 18, are only getting Covaxin. Till date, mixing and matching not allowed in India. Where does science stand on mixing and matching of vaccines, sir?
Great question. I don't think this has been as adequately studied as the original vaccine trials, but we know now that mixing and matching at least is safe. There was a study from Spain many months ago where people who received AstraZeneca first and then received an mRNA vaccine had actually better immune responses. There are studies where people who received one form of mRNA vaccine did well with the second form, meaning if they first received Pfizer, they could receive Moderna afterwards and did well. Same can be extrapolated for other vaccines as well. So it is true that mixing and matching is largely considered safe at this stage. There are just too many combinations, and I don't see as much evidence that I could quote you numbers as to what's best, what's not. But it's important to know that it's likely very safe. We have not seen any problems emerging from it. And that's helpful guideline, because now every country can determine based on the available vaccines as to how they can mix and match.
Right. And one more question, sir. In the United States, we are seeing a large number of hospitalization of children. The silver lining here in India, because our healthcare system, of course, still needs to cope up, is that we are not seeing that number or a high number of children who are landing up in hospitals. Help us understand, why is this happening? Because as far as experts, in-house experts within the country are concerned, and the data which is emerging within India seems to suggest that Omicron is not affecting children the way it affects adults.
It's a very important, sensitive, emotional topic. And I want to first make sure that the parents should not be extremely worried about it. This is no reason for panic, because what you're seeing in USA is multifactorial. Children in our country are still about 33-34% vaccinated. So a large number of children are unvaccinated compared to adults. Therefore, they will get more infections and more prone to it. Our schools have remained open. Therefore, more transmissions have occurred in the schools. As far as the data of hospitals filling up, once again, is multifactorial. Previously, we had 2.5 children per 100,000, which were getting hospitalized during Delta. During Omicron, that number has gone up to 4 per 100,000. But we don't know if that's just a matter of larger number of infections in the community. It may also be the reason that very young children, those who are 1 or 2 years old, their upper respiratory tract is still developing. And since Omicron affects the upper respiratory tract more, they may land in a hospital quickly, but the overall bad outcomes still exceedingly rare in children, exceedingly rare compared to someone who's 70, 80 years old.
Right. And sir, as far as vaccinating children are concerned, what really are the benefits of the same? Again, in India, I ask you this because even as we speak, most of our prime time discussions are on the same, because vaccinating children, that has started only for 15 years and above. Till now, there is no policy to vaccinate those who are below 15 years of age.
So, whenever it comes to policy in other countries, I defer to experts on the ground. They are living there, they understand the realities, they have all the data points. So, I respect their decision. When it comes to science, now we know that ideal state, we should vaccinate the world. That's the message. Vaccine safe for children over the age of 5. In a large country with a very large population and many other factors to consider, like India, I'm pretty sure that these policies are based on priorities and what's available and how quickly it can be rolled out and who's more at risk versus who's less at risk. So once again, I don't think there's as much debate in science as there is in policy, and that's where it's because there are some realities that have to be considered.
All right. And so, when we come about myth busting, I was going through your Twitter feed as well. Time and again, you've reiterated how we need to realize that Omicron is not mild. Time and again, we have experts and many studies which have come out now, which so-called claim that the pandemic is turning into an epidemic. There is no need to worry. Omicron is mild. What is your take on that?
Yeah, I think, as I said, Omicron is milder than Delta. It's not mild. That's like saying this lion is not as ferocious. Now, you won't go in the cage of that lion just because it's a little bit less ferocious, right? So I think Omicron is still piling up deaths here in USA. Yes, a lot of deaths are lagging deaths from Delta, but our hospitalizations, we have seen the number of hospitalizations like we never saw with Delta. If it was a mild variant, we would not be so stretched in our healthcare system. We have blood shortages. We have healthcare staff out sick. We are seeing transmissions in the hospital. Elective surgeries are canceled. We are seeing people lining up and they can't find a test. None of this happens if something is mild. So I think we got to be very careful because this variant can break through the previous immune wall, meaning if you had Delta and you recovered from Delta, you are not protected from Omicron. It can still infect you. You will have some immunity. You're likely not going to have a bad outcome. But I think our message should be of caution. I never promote panic. I don't think that's the right message. But the other extreme of let's just lower our guard and move on with life also is a little careless. We need to stay in the middle.
Right. Fair enough, sir. Caution, not panic. Of course, that's the message coming from your side. But, just to take another thought, which you had put out on your own Twitter feed forward, sir, you'd spoken about how someone who gets Omicron needs to isolate, starve the virus inside, and only then go out and ensure that, they don't pass on to others. What really is the ideal number of days for quarantine? Because there's a lot of confusion around that as well. Earlier, it was 15. Now, in some countries, it's 5 days. In some countries, it's 7. What is the data on that? What does science say on that, sir?
Sure. So the short answer is 10 days, and I'll tell you why. Because when you deal with medicine, this is not mathematics. You're not dealing with numbers. You're dealing with human bodies, and there are 8 billion immune responses out there. Everybody has their own what we call host factors. I may clear the virus faster, you may clear it more slower, and so on. When we say 10 days, that's based on large studies saying that a very large number, 90, 95, 98% of people will not be shedding live virus after 10 days. You have to draw a line somewhere. I think the 5-day strategy that CDC recently came up with that created some confusion was based on a practical reality, because our hospitals are short staffed and we want some people who are really, really essential back in the workforce. I understand how that's controversial for some people, but I work on the front lines. I understand when
Mhm.
it's risk benefit. Me being in the hospital on day 7 with a proper mask
Yes.
can do some harm, but if I'm not there, many people may die. So these are difficult decisions, but for an average person, they should simply remember 10 days is a good number to work with.
Fair enough. And so before I let you go, my last question, since we are discussing and significance of masks, you had shared your personal experience. You had yourself, unfortunately, been infected with COVID. Now, it's good to see you fully recovered, sir. Share your experience with us, especially in the context of wearing masks, because that's exactly what you emphasized on.
Right, because I think there is still distrust, and that's what's baffling after 2 years and millions of people dead, and us seeing all kinds of footage on TV. There's still people who mock this virus, who think it's not real, who believe masks don't work, who think vaccines are a hoax, and so on. So, what I would like people to know that I've been around COVID patients for more than 1,000 times since this pandemic started over the past 2 years, and I did not get infected because every time I was wearing a mask.
Yeah.
I went to a personal gathering for 2 days, maskless, and I got infected. So what does this prove? This proves that masks work. Otherwise, I'm around very sick COVID patients who must have very high viral loads. Those rooms must be loaded with the virus, and I didn't get infected for 2 years. So I think my plea to everyone is that please wear good quality masks. If you cannot afford them, I don't want you to throw away your N95 every day. You can buy 2 masks, N95, N95, put one in a paper bag in your car, use the other one today. Tomorrow, put this one in the paper bag, take that one out. And you can keep using these 2 masks for weeks and months as long as they continue to seal around your face. Please do that.
Yeah.
Protect yourself. Once this wave recedes, hopefully we should be in a better position.
Well, absolutely, sir, and that really is a great public service message, and I hope the viewers also take a cue from that. Don't panic, but be cautious. That's really the message coming from Dr. Yunus's side. For now, sir, thank you for joining us on NewsX. Thank you for taking our time.
Wish you best of luck.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.